This call is being recorded. If you do not wish to be recorded, please disconnect at this time.
If you've got health care already, then you can keep your plan if you are satisfied with it.
If you like the plan you have, you can keep it.
I intend to keep this promise. If you like your health care plan, you'll be able to keep your health care plan.
If you like your plan and your doctor, you can keep them.
You'll be able to keep your health care plan. If you like your plan, you keep your plan.
If you like your doctor, you like your plan, you can keep your doctor, you can keep your plan.
If you like your current insurance, you keep that insurance. Period. End of story.
If you've got health insurance, you can keep it.
If you have insurance that you like, then you will be able to keep that insurance.
If you like your health care plan, you keep your health care plan.
Nobody's going to force you to leave your health care plan. If you like your health care plan, you will keep your plan.
If you like your health care plan, you can keep your health care plan.
If you like your health care plan, you can keep your health care plan.
No matter what you've heard, if you like your doctor or health care plan, you can keep it.
If you like your health care plan, you can keep your health care plan. If you like your private health insurance plan, you can keep it.
If you like your private health insurance plan, you can keep your plan. Period.
Nothing in this plan will require you or your employer to change the coverage of the doctor you have.
If you are among the hundreds of millions of Americans who already have insurance, nothing in my plan will require you or your employer to change the coverage or the doctor you have.
If you want to keep the health insurance you got, you can keep it. If you like your plan, you can keep your plan.
If you like the insurance plan you have now, you can keep it.
If you like your plan, you can keep your plan. So if you like your plan, you can keep your plan. If you like your plan, keep your plan.
If you like your current insurance, you will keep your current insurance.
If you like your insurance plan, you will keep it.
If you're happy with what you got, nobody's changing it. If you're one of the more than 250 million Americans who already have health insurance, you will keep your health insurance.
If you have health insurance, the only thing that changes for you is you're more secure. If you already have health care, the only thing this bill does is make sure that it's even more secure.
If you've got health insurance, you keep your own insurance.
Today, I want to speak plainly, clearly, honestly. If you already have health care, you don't have to do anything.
And everyone who already has health insurance will keep the benefits and protections this law already has put into place. Period.
Period.
Period. End of story.
You have or had one of these plans before the Affordable Care Act came into law, and you really liked that plan. What we said was you could keep it if it hasn't changed since the law's passed.
Good day. I am the voice of We Provoke Thought. We Provoke Thought is an organization and show that is the platform for those who have an opinion, idea, or educated information to share to the world. An outlet, if you will, to voice your feelings and facts. Now today, listeners, we have a gentleman on the line, and what we're talking about is something that is very important to the American public, and that is the affordable health care reform, or the Obamacare. And we found that the tension that is building up around this whole Obamacare or health care reform is that the American public aren't really knowledgeable of what's going on and what's to come. If I were to ask one about the affordable health care reform, I would probably get a lot more positive response than I would with the Obamacare, or vice versa. And what I want to do is address the American public in making sure that we are all aware and knowledgeable of what is to come and what is the Obamacare or affordable health care reform. Just basically trying to build that dialogue to get that true literacy on what is the affordable health care reform and what is to come with it. So today, once we will begin with the gentleman continuing having knowledge that the call is being recorded, that you continue to agree with the recorded call, and that you agree for We Provoke Thought to publish this call without releasing your identity, phone number, name, or any information leading to you on We Provoke Thought's YouTube channel, Facebook fan page, and soon website. Now, good day, sir. How are you doing?
Pretty good, thank you, sir. How are you doing?
Good, good. And just so that I can give the listeners an idea of the demographics in that we're reaching, what city and state are you in?
I'm in California, Hawthorne, California. Los Angeles.
All right, fair enough. Good, good. Well, out on the west side there, we like to know just exactly where the American public lies with the affordable health care reform, or what we would call the Patient Protection and Affordable Care, the Act, or AKA the Obamacare health care reform. And then what I find that interpretation and perception, that is reality to the American public. So with this, what is Obamacare to you?
Honestly, the Obama administration didn't explain very clear what these terms are. But my understanding, listening to different radios, conservatives like Rush Limbaugh or other side, the Democrats, they have that different opinion. To my understanding, they made it, more political than actually helping people. The thing is that I was really happy in the beginning that will help poor people or people that's not covered. But it looks like they made it a big deal for election. I don't think this will a success because even though Obama probably has a good idea, at least he's trying to share or cover people that don't have cover. But to my understanding, more, on the conservative side, they try to fail the system. Sharing, coming from another country, if you see more Canada, France, and all other countries, they have at least some people has cover over here, but I see people over here dying, they don't have any kind of cover, just for a basic checkup and stuff like that. To my understanding, I thought Obama will take care of that stuff. But the way, now people getting different opinions, looks like they're gonna make it more harder for to afford this kind of insurance. So basically, looks like the propaganda machine is working very good against Obama at this time, and really everybody has to study it. They have to give time to people to study and and get knowledge and then choose. A lot of people are really ignorant about this, the whole thing.
All right. Well, and you mentioned Canada and France and some of those other countries, and it seems as if this social health care reform is something that has been adopted around other countries outside of the U.S. And with that, it seems as if that one would, or some could say that we're actually behind when it comes to a health care reform or a plan that is a social health plan that would better address the American public with the ill and those who are unable to afford insurance for their health. Is that where you stand with that?
Absolutely. America is really behind, the whole thing in, medical and coverage and stuff like that. They are a lot behind the people that live. My relatives live in Canada. They don't really have no worries about, that they're gonna go to doctor or denial or bills and stuff like that. In America, really,
right.
I'm only person working, and I have 3 kids and wife. Honestly, it breaks backbone of your things here. Even though I have a good benefit, good insurance through my company, but still, that's a lot. What happened if I, lose this job?
Obamacare. Fun. Cool. YOLO. At Obamacare, we believe in saying the words affordable health care so that young people will love us and sign up like lemmings. Sure, you pay 2.5% of your income in penalties, but young people don't have to worry about that because you don't have a job. Work sucks. That's why we at Obamacare want to trade your full-time job for a part-time one. So you'll have more time for fun things, like watching millionaire celebrities tweet about how affordable we are. Obamacare. Just like guys enjoy premium leather seats, so too you'll enjoy paying triple the healthcare premiums out of your new part-time salary. Speaking of guys, ever been on a mandate before? At Obamacare, we're full of mandates. But don't worry, big corporations get exempt, so you don't have to. It's fun paying for things you don't even use. Yeah, you work out, stay healthy. But come on, brah. Someone's gotta pay for people who smoke, drink 85-ounce sodas, and live in a Barcalounger. So enjoy your premium hikes, young people of America, because everyone loves hikes. Obamacare. If millionaire celebrities can afford us, why can't you? A message from the White House Office of Obamacare. Propaganda to get young people to love us and sign up like lemmings.
something like that, they will be really a disaster. So American has to clearly, Republican and Democrats has to come together and work for, not for election, not, just, they are fighting, all this year fighting Republicans fighting Obama how to show that they are weak because the election is coming and stuff like that. So America is so much, how you say, divided that really this Obamacare nothing gonna help.
All right. So let me ask this question: do you think that the country needs, or it sounds as if you feel as though the country needs a reform in its health care? Is that correct?
Absolutely. It has to be done. If it's not done, it will be forced. Honestly, devolution will be a strong word to use at this case. People will fed up because the upper class is going up and lower class is going low. There is no middle class going away. And I'm not really surprised that one day, it will change completely, and everybody gonna come to the street like I don't know what they call occupied, just
the occupied Wall Street, right?
After the Egyptian revolution, stuff like that. And I'm not going to be surprised that American people will come to the street and kind of demand and change a lot of stuff.
A revolt would happen. All right. Well, who benefits, in your opinion, from Obamacare or the affordable health care reform?
Honestly,
who benefits from it?
To tell you the truth, I didn't, since most Americans are busy working so many hours, and there is not too much time to read about it and stuff like that.
Don't get on that ship! The rest of the book, To Serve Man, it's a cookbook!
No! How about you? You still on Earth or on the ship with me? Really doesn't make very much difference because sooner or later, will all of us be on the menu? All of us.
And stuff like that.
Right.
The way they explained from the beginning will be the people that they were not covered, and most poor people. But now the media made it so opposite way that they will hurt, the poor people, and they will be paying every year more and more money. And they will, and basically, as you know, that just they had a fight, how to defund it, and they couldn't succeed. Conservatives now, they are working the other way propaganda to show that they will fail. But the Obama administration didn't come clearly to explain to people that's a really easy way, 2 plus 2 is 4, so make it easy for people to understand. So people believe that will hurt both people and uncovered people in long run.
And I'll ask these last 2 questions here. Now, do you believe that it was fair or that it was wise to have the insurance companies, the big corporate, the big insurance industries, to write this healthcare reform? Do you believe that was a smart decision to have them
I'm sorry. Go ahead.
Yeah, no. Do you believe that it was fair or that it was wise to have the insurance companies write this deal, almost like a blank check, if you will?
Honestly, that's totally wrong. If the Obama administration did this one, that's totally wrong. You cannot give a butcher something that make a decision. They are most I don't want to say capitalists. Big money maker, and they're not going to make anything that they're going to hurt or it will help the public. So it should be from the administration. It should be by, by lawyers and stuff like that, written up that really by people that really help people, not by
some type of bipartisanship. Correct.
Right.
Right. Okay. And with that, just listening to what you were saying, so I believe that you would agree with this statement here is that basically the language in which the Affordable Health Care Reform has been written is not written so that the American public can truly understand it, and that the information about the Affordable Health Care Reform hasn't been widely presented to the people as well, or the ones who represent the people, so that those representatives can truly get an understanding and a hand of what has been written inside this affordable health care reform and exactly how it affects the American public. And right now, that's the reason why we have the divide. Do you agree with that or disagree?
I agree with your statement. Absolutely. There is no explanation and no motivated easier to explain. And the people that the other side people, I mean the opposition, took advantage of this weakness of Obama administration, and the counterattack is really strong these days, especially if some people are listening to radios, conservatives, especially Rush Limbaugh and all that other conservatives. They are night and day working so bad that really, if you hear it, every time you listen to them talking against Obamacare and which
right, it's become a political circus.
Yes,
it's just another move for just a bunch of ratings and a bunch of shows to focus on this and not truly. And this is the reason why We Provoke Thought is so important, is because we want to hear the voice of the people. Enough of the political roundtables being set up, going back and forth. These staged interviews, these staged meetings and groups that will talk about one side and the other and give information, and sometimes it's misinformation, and a lot of times it's spoken in a language that you and I both don't understand. They throw words out there that mean nothing to us. Here, the American people get to speak truly about how they feel about the healthcare reform and basically speak about what it is that they desire. So I agree with what you were saying there, and I do also appreciate you allowing us the opportunity to allow you to voice your opinion and your feelings on this. Now, with that, I'll leave you with this one last statement here. If you had the power, what would you do with it?
If I had the power, first of all, like Obama came, you have to have guts, and also be close to people and attached to people. And I thought Obama was one of the guys, and basically come with a really clear agenda, and just work for people, which he really tried. If I was really in charge, I will just get information from all those countries that really their health system works.
Gotcha.
And put it in the agenda and give it to people when people choose it, and just go with that agenda. Unfortunately, nobody really does that in America. Everything that they do, they fail. And fail. I don't know what's going to be the future of this country. As we can see, really not in this front, and we're losing in most fronts. I know this is the biggest country and number one country, but still, really, we need a really clear agenda, from the administration. Or we need strong, good people to take care of this country.
And I like that, and I appreciate that, and I'm going to repeat exactly what you said just there, and because I haven't heard that they should have gone to those countries where their social health care was working for them, and collectively gather that information and come up with a reform that would better suit the American public, rather than just leaving it in the hands of the insurance companies and to seek out their better interests. And I like that, and I appreciate that information there. Again, I thank you for allowing us to be the platform for you to voice your opinions. Here, We Provoke Thought, and for that, we do not apologize. I thank you again out there in California, and I'm going to say goodbye to you on the other end.
This call has been recorded.
Okay, ladies and gentlemen, if you will, look right here.